The behavior change component of the project is looking at the essential wash and hygiene behaviors that cuts across all the project's major areas in terms of water, sanitation, and hygiene. And these are done through the use of the behavior change communication package that was developed by the Manov Group for this project.
The booklet has components of them to teach school children how to wash their hands, to teach families how to take care of their latrines and their surroundings, to teach healthcare professionals or healthcare practitioners how to make sure they practice their IPC.
You play. If you get 6, you start. So if you play another, you get maybe like 4. You count. If you lie on a black place, they'll give you a paper to answer a question. So if you get it correct, they'll promote you.
The game is very interesting, and what we learn from it is to keep ourselves clean and the environment clean.
It tells you what open defecation is, how to clean toilets. You can find it in the picture. The way a good environment should be, it has been stated in the picture.
From what we are seeing, we can see that this is something that will have lasting impact, because when you catch young people like the school children at early age, and people, oh, these behaviors, we didn't even know that they exist. But right before us, see, they are easy and simple things that we were doing, but we never realized that they're either good behaviors or they are bad behaviors. But with the game, it helps to let people really identify these behaviors easily and translate them as themselves.
Hygiene, sanitation,
when we did the media project review, we realized that behavior change in terms of the adoption to safe drinking water changed from 26 to 29% over a period of 9 months within the project, which we think is a very good impact as far as the project is concerned.
So we have also been working extensively in schools with menstrual hygiene management.
For menstrual hygiene management, we're working closely with Ghana Education Service in basic schools across, again, our project regions.
Some of the ladies, they don't have money to go and buy pad. They will use cloth.
When you have your menses, you cannot come to school.
We are in the rural area. So for my girls, when they are in their menstruation period or time, at times they find it difficult to come to school just because they will not get the necessary materials to do or to help themselves.
One of the key innovations is the supply of reusable menstrual hygiene materials, which we get from a partner called BGL. They are reusable panties, and I must say they are first in the country, which comes with special towels as well. These materials or panties can last as long as 2 years if the girls are able to use them very well. So which means that they don't need to procure or buy menstrual pads every now and then to use. They are very hygienic and then very easy to use as well.
Just open it gently. Let me see your big girl panties. Is it beautiful? Yes. Girls, do we like it? Yes. Okay, so let's say big girl panty. And I said it's used for what? Only when we are? Only when we are? Okay.
We need to bring it to the Ghana Standards Authority and Food Drugs Authority for them to give us the necessary approval for us to produce on scale to be able to get to the corners of this country, because there are a lot of vulnerable girls who, even as a result of not having menstrual materials, even drop out of school, and that's not the best.
We also support them with a simple tool called the Smart Cycle, which we teach them to use to calculate their menstrual cycle.
They have printed some of our menstrual hygiene materials, even for the schools to use. And so it also supports the education on menstrual hygiene.
For us, it's very important to break some of these stigmas that have been affecting girls and preventing them from attending school. We have not only worked and trained girls, but also the boys, who have a lot to do with that, and the parents as well. We have been working on cholera prevention as well since 2014, 2015, when we saw the last large outbreak of cholera. Since then, we have been working in hotspots.
So we started the quarterly disinfection exercises in Cape Coast, and I could say that it was very successful.
There were a lot of also COVID mitigation interventions.
What we did was to really intensify playing of a lot of hand-washing jingles on radio stations.
The people working on the healthcare facilities are trained in the various forms that they have segregated water for drinking, water for cleaning, for disinfection, making sure that the waste is being treated properly.
In the slum and the bigger cities of Kumasi and Accra, where environmental health officers supported along, the capacity that was given to them through this project helped them to even continue burying the dead.
We also supported most of the institutions, especially the markets, very public places in communities where we work. We supported them with hand washing facilities.
Last year in this community, following the opening of the Bagre Dam, the whole community was flooded.
The first thing Global Communities did was to carry out an assessment.
So after the assessment, they came with the support of the Municipal Assembly to disinfect this community to prevent outbreak of cholera.
We realized that houses collapsed, farmlands were washed away, the roads were blocked because they were flooded and communities were cut away. The boreholes we provided in some of the communities were submerged. Some latrines also collapsed.
So the first thing we did was to send aquataps, and aquatap is water purification tablet that purifies water. So once we are able to send that to the community and for the household to use it, you are rest assured that they would have potable water to consume within these very challenging times, and that will save lives.
This will help to make the water wholesome and safe for drinking, and to improve their health, so that it will also help to prevent future water and sanitation related diseases like cholera, etc.
Again, we also build the capacity of the environmental health officers and the NADMO officers how to use the water treatment or water purification tablet, that's the aquatap, before they went ahead to distribute it to the community.
Barachana tete robarma, ne swasu, ne bondo badama, ne pestedent, ne chibodama, atom the shebo mattress.
There are still many places, many regions and districts, communities that don't have access to water or proper sanitation, and we need to pay attention to those districts, regions, and communities to make sure that they have access and they have a dignified sanitation.